Hi, I'm Abdullah Shtavafor. I go by Abi, and I'm a primary care sports medicine physician. Our practice is a place to go for sports injuries and more, mainly because we have a care team that excels in communicating with each other. We just don't have orthopedic surgeons, but also primary care sports docs, physical therapists, nutritionists, physiotherapists. We offer a wide various range of services from interventional evaluations to surgical evaluations and much more.
Hi, I'm Dr. Noor Alzarka, and I'm a primary care and sports medicine doctor. A good treatment plan starts with an accurate diagnosis. With my years of training and experience in sports medicine, I feel equipped to evaluate and manage and treat most muscular and joint issues or injuries. So first, I will educate my patient about the diagnosis, and next, I will outline a treatment plan. I believe in partnering with my patients to make shared decisions about their health and goals.
My name is Josh Griffin. I'm an orthopedic surgeon in the Woodlands, Texas at the UT Ortho office that partners with Memorial Hermann. I do orthopedic sports medicine with a focus on shoulder and knee. I became a doctor because I love helping people, and it was a situation of being able to use gifts, talents, and interests with science and math and thinking outside the box that really fit in my desires to become a physician.
My name is Dr. Benedict Fetti, and I'm a primary care sports medicine physician at Memorial Hermann Medical Group. Whenever anyone's dealing with the injury and kind of recovering from that, I tell them to start with the end in mind. If they're able to see the end goal, it provides much more of a motivator. If I have a patient or an athlete who reaches that goal, that recovery back to where they want it to be, it gives me the ultimate satisfaction because that's what I'm in this for. I love sports medicine. I love getting people back healthy.
Hi, I'm Dr. Ariana Amini. I'm a primary care sports medicine doctor with the Memorial Hermann, the Woodlands. I love talking about injury prevention with my patients. We talk a lot about how their alignment is going, maybe shoe wear, and so it helps us to really be able to hone in on each individual's needs. Everybody is shaped differently and their fitness level is going to be different, so talking about hydration, nutrition, different exercises they could do is really a cool part of my field.
I'm Dominic Manine. I'm a primary care sports medicine doctor at Memorial Hermann, the Woodlands campus. I think as a primary care doctor, we kind of take a unique perspective of really thinking about how it affects it on a mental level. So you got to get the patient to buy into the mental aspect of rehab and recovery and what that looks like, and then finding out what their goals are so you can curtail the treatment towards that.
Hi, I'm Dr. Bonnie Gregory. I'm a fellowship-trained orthopedic surgeon and sports medicine specialist. I think one of the most important parts of caring for both athletes and patients is coming up with an accurate diagnosis, and then after making that diagnosis, taking into consideration a patient's demands, activity, interest, as well as for my athletes' time of season and goals to make the best patient-centered plan possible.
My name is Eric Kleinberg. I'm an orthopedic spine surgeon. We see a whole host of injuries. Disc herniations are probably the most common in athletes, so we can see disc herniations in the cervical spine, and then we'll see advanced injuries that can happen over time. There's also trauma that can occur. The great news with athletes is you usually don't have to motivate them. Usually it's more about understanding, again, their expectations and then trying to get them back to the game that they love and enjoy. And so it's tailoring physical therapy programs so that they can become the best versions of themselves.
I became a doctor because I want to help people, but not just help them in a medical way, to also be their health coach, to make them be the best that they can be, whether it's from their nutrition status, their injury status, or just maintaining their chronic diseases. So for my own personal wellness, I think about getting good sleep, taking care of myself by eating well, exercising well, and doing what makes me happy, which is be with my family and also hang out with my friends.
My name is Evan Meek, orthopedic surgery sports medicine specialist. Whenever you see somebody that has made it back because they come in, kind of the thank you that you know comes from their heart, makes you feel good inside that you're able to help somebody kind of get back to life, and they were feeling stress and frustrations of not being who they wanted to be, and when they do reach that, and you can kind of see it in their eyes and tell with the way they kind of address you and thank you that you really did help them, and that's what kind of keeps us going.
I'm an orthopedic surgeon out in Katy, Texas. I do general orthopedics with a subspecialty in shoulders as well as knee surgery. Memorial Hermann is one of the biggest and most innovative hospitals in the Houston area, constantly improving their policies and procedures for the betterment of patient care. There's a lot of care given to patient improvement and patient satisfaction.